You're listening to Be Health Connected, a podcast by the Gateway Business Health Coalition. Your host for today's episode is Dr. Kelsey Hannon, BHC Director of Research and Analytics.
Hello, I'm Kelsey Hannon, Director of Research and Analytics at the BHC and Midwest Health Initiative. Welcome back to the BHC's Be Health Connected podcast. Today, we are joined by Jill Berger, Senior Advisor for Employer and Payor Engagement at the Leapfrog Group. The Leapfrog Group is a national nonprofit organization driving a movement for giant leaps forward in the quality and safety of American healthcare. Leapfrog collects and transparently reports hospital performance, helping consumers protect themselves and their families from errors, injuries, accidents, and infections.
Jill, it's so great to have you with us. Can you start by sharing a bit about your career journey from your time at Marriott to your current role?
Sure, I'd be happy to. And thank you for having me. I am going to start a little bit with my career before Marriott. Right before Leapfrog, I ran benefits at Marriott for 20 years. But even before that, I was working in benefits at General Motors. And I was there when the Institute of Medicine came out with a report that said almost 100,000 people die annually of preventable medical errors. And General Motors at the time was the largest private employer in the country. And my boss at the time, Bruce Bradley, said, not on my watch. That's a lot of GM employees. And he got together with a number of other large national companies to form Leapfrog, with the mission to take giant leaps forward in patient safety. Shortly after that, I went to Marriott and I started running benefits. And I stayed part of Leapfrog because it was important to me and important to Marriott that we offered health benefits, health plans that were high quality and safe. We wanted to make sure that the providers, including the hospitals we offered, were high quality and safe. And so it made a difference to stay part of Leapfrog. I joined the board at Leapfrog. During that time, I ran the board for a couple of years. So I like to say that Leapfrog is in my blood. Patient safety is in my blood. And so when at Marriott, when I started, because Leapfrog was pretty new, none of the hospitals in the DC area, including Virginia and Maryland, did the survey with Leapfrog. Leapfrog does a national survey of hospitals so we can assess how well they're doing when it comes to patient safety. And so I met with the hospitals. And at first I was a little hesitant. I wasn't sure that the hospitals wanted to meet with us. I mean, Marriott at the time probably still is one of the largest employers in this DC area, but small compared to, the realm of a hospital's patients. But they did want to meet with me and they cared. And just by telling them we cared about safety and quality and we cared that they did the survey, they did the survey. And so all of the hospitals in this region do the survey to this day. And so I retired from Marriott about 6 years ago, and Leapfrog was a natural place for me to go because I have a passion for quality and safety. And I came to Leapfrog and I work with our employer groups and our regional leaders like you guys to really think about ways we can keep the momentum going.
Thanks for sharing that, Jill. I'm just so impressed. You have been involved with Leapfrog, not only on the Leapfrog side, but also on the employer side, and for so long, and doing this important work. Can you tell, and you alluded to this a little bit with your old boss, Bruce Bradley, but can you tell us a little bit more about the Leapfrog Group, what you do, the Leapfrog Hospital Safety Grade, and the survey for those of our listeners who might not be familiar with it?
Absolutely. So the Leapfrog Group is an independent national nonprofit focused on patient safety. We're celebrating our 25th year this year, so we're very excited about that. Leapfrog, it was employer founded, as I explained, and is employer run to this day. So the majority of the board is our employers. And that's really important to make sure what we're doing is employer driven. It's what the employers want. So the survey is one of the most important things we do. I can remember the days when we had 10 hospitals doing the survey in the beginning, 25 years ago. We are now up to having 2,600 hospitals do the survey. It's voluntary, it's free. And I think one of the reasons that hospitals do the survey is they want to see how they compare when it comes to safety and quality to their competitors. They want to see nationally, but they also get the requests from their customers to do the survey, like you guys, like your employers. So 2,600 hospitals represents 80% of the beds in this country. So that's pretty significant. The survey was developed with recognized national experts, which I think is important to understand, to assess the hospital safety and quality. And everything we do, we're completely transparent. So you can go online and to our website, leapfroggroup.org, and you can see who our national expert panels are. We have them for the various sections of the survey and the safety grade. And we also rolled out an ASC survey, Ambulatory Surgery Center survey, because employers came to us a few years ago and said, hey, Leapfrog, you have great information on hospitals. And by the way, 60% of our services take place in an ambulatory surgery center. We need to understand about that. And so we did develop an ASC survey back in 2019. The first time we do a survey, we don't publish data because we want everybody to get used to the questions, to make sure the questions make sense, our methodology makes sense. And then the following year, we roll it out. So 2020 was going to be our year. And of course, COVID. And a lot of ASCs were either shut down or repurposed. And so we're just starting to go after ASCs to do our surveys. And if you're starting slowly, but if your ASC hasn't done a survey, please ask them to. And so the safety grade we started in 2012. We assign letter grades, so it's not voluntary. Hospitals don't have to do anything. We assign the grades based on how safe they are. And their grades, letter grades, A, B, C, D, F, just like school. So consumers can look at the grade and understand immediately how well the hospital is doing. We do that twice a year. And the survey we do once a year. The safety grade we do twice a year. As a matter of fact, May 1st, we just rolled out the spring safety grade, so we're pretty excited about that. We give a grade to all general hospitals in the United States based on their ability to protect patients from medical errors, accidents, injuries, and infections. The safety grade looks at things like hospital-acquired infections, MRSA, C. diff, central line infections, looks at surgical errors, objects left in a patient during surgery, following surgery. These things happen. Look at hand washing. This is one of the largest places that a hospital can prevent infections. Looks at safe medication administration. So when you're in the hospital, you need to be wearing your hospital band on your wrist, and it'll have a barcode, and you want to make sure the nurse ensures the barcode matches the drug that they're giving. Computerized physician order entry for medications. So many things that the safety grade looks at. Grades are determined by public peer-reviewed methodology calculated by the top patient safety experts. Again, we have expert panels for the safety grade. and you can see who they are by going online. In fact, you can go online and see all the questions that are asked and considered for the safety grade and the survey. Look at the methodology we use for assessing it. It's all transparent. Leapfrog receives a lot of press on the safety grade. Newspapers, USA Today, other news sources, NBC, CBS News loves to publish how safe is your hospital because people care how safe their hospitals are, and it's a great way to get consumers not only reading the articles but to our website, because our website, which is free to all consumers, tells them not only what the safety grade is but what went into it, so people can really look at how safe their hospital is and why they may or may not have gotten a great grade. So we're pretty proud of that.
Yeah, and just to reiterate what you said, Jill, the safety grades are extremely consumer friendly. The website that you mentioned for the safety grades is also really consumer friendly. It's easy for a patient who's trying to select a hospital to go on and see how the hospitals in their region are performing. It's a great resource for our listeners to look at and to talk to their employees about when they're selecting a place for care.
Great.
You mentioned that the most recent safety grades went live on May 1st. I'd love to talk about the specifics of that a little bit. So, what stood out to you in the spring safety grade release? And were there any regional or national trends worth noting for our listeners?
I would say one of the things we looked at for the first time, the Leapfrog data shows that 346 of all eligible hospitals have not only achieved an A for the spring 2025 safety grade, but have sustained an A for over 5 grading rounds, designating them a straight A hospital. And that's now on our website. So when you look up a hospital, you can look up whether or not they're a straight A hospital. 12% of hospitals have achieved this recognition. And the important thing to note is hospitals that consistently earn a grade A typically have strong systems in place to protect patients, saving thousands of lives by preventing potential harm. All hospitals should be earning an A, and we want to make sure they don't rest on that laurel, which is why we started looking at this. Patient safety is a relentless, never-ending quest to put patients first, which is why we are highlighting the hospitals in the US that have earned straight A's for over 2 years. Sustaining an A over multiple years reflects a deep-rooted commitment to patient safety. And a 2019 analysis found that if all hospitals in the country were A hospitals, that over 50,000 lives would be saved, that's huge. A spring 2025 safety grade also highlights continuing progress in reducing hospital-associated infections, which can cause serious long-term complications, extending hospital stays, and in some cases, death. So that was great to see. During COVID, hospitals got so busy, infection rates started going up, and so we are very happy to see that they're now going down again.
I would like to shout out two of our local hospitals in Missouri for the sustaining their A grade for the 5 rounds. And those two hospitals are Mercy Hospital in Springfield. From the name, you can tell it's in Springfield, Missouri. And then the other one is St. Joseph Medical Center, which is in Kansas City, Missouri. Just a really impressive achievement for these two hospitals, and we appreciate their commitment to patient safety. One thing I want to point out for listeners is that the BHC is a regional leader for the Leapfrog Group for Missouri. And what that means is we connect the local hospitals with Leapfrog, we directly connect with them. We ask them to participate in the Leapfrog survey. We actually just sent out letters asking all of the hospitals in Missouri to fill out the survey this year. And then we also spread the word when new safety grades are released. So part of my job and part of BHC's role is to keep track of what's happening with the safety grades in Missouri. And so we put out a press release. We also do social media posts about it. What we see in the May safety grades is that in state rankings, Missouri dropped to 40 out of the 50 states in the ranking of the percent of A hospitals in the nation. And this is a downward trend we don't want to see for the state of Missouri. And it's concerning to the BHC and part of why we asked you here, Jill, and part of why we are reaching out to hospitals more often and asking them to participate in the survey to let them know that BHC employers are concerned about patient safety. Following that, why should employers care? Why does hospital safety and transparency matter for the employers who purchase healthcare on behalf of their workforce?
That's a great question, Kelsey. And I can tell you that upwards of 200,000 people die annually due to preventable medical error. This is annually. And that's how many people die. That doesn't include the number of people that are hurt or harmed by errors. And when errors happen in a hospital, employers pay the price in more than one way. Beyond the harm and suffering to employees, which you don't want to see, employers and other purchasers pay an average of $7,500 per error per hospital admission. That's a lot of money.
Yeah, wow. Wow.
Hospital safety grades matter because they give patients a clear, reliable information about a facility's safety performance, helping them make informed choices about their care. To stay safe, patients should ask questions, understand their treatment plans, speak up if something feels wrong. If you have clinicians or any staff from the hospital entering your patient room and not washing their hands, patients need to ask them to do that. It's very important. By using resources like the hospital safety grade website, patients can select hospitals that prioritize safety, ultimately contributing to a safer hospital stay for everybody.
Another resource I want to mention is BHC releases a consumer guide to healthcare. It is a pamphlet that features tips for patients to use when they have an inpatient stay. Just like the questions you mentioned, Jill, asking your providers to wash their hands. And there are some other recommendations, but we also list the hospitals in the St. Louis metropolitan statistical area with their CMS star rating and their Leapfrog safety grades. So this is a place that BHC employers can go to, as well as the Leapfrog website. We release a resource that employers can use and distribute to their employees, and they can find the 11 hospitals in the state, as well as in Illinois, that earned an A safety grade, and they could use this to select care and take it with them when they go to the hospital. It will link all of these resources on the website too after this. So we've talked about the safety grade. We've talked about why safety and transparency matters for employers. If an HR benefits professional is listening to this, Jill, and with your immense experience in this setting, if they want to start sharing information on hospital safety and quality with their plan members, what advice would you give to them?
So we provide an employer value toolkit on our website. And this is actually what I used when I was at Marriott, because we tried to put something in place that is easy for employers to download and display. But the first thing that employers can do is we have a lives and dollars lost to medical errors calculator that's pretty easy to use. It was developed by the Johns Hopkins Armstrong Institute. And it's an eye-opener for employers to see how much errors cost them based on their data and how many lives may be lost, how many of their associate lives may be lost due to patient safety. So it's a great place to start and even communicate that data to employees who think, oh, I'm already going to the best hospital, because everybody thinks their hospital is the best. And sometimes you have data that says there's room for improvement. Check the safety grades of your local hospitals for the benefit of your employees. You can also print that information. And then communicate with your employees. Tell them who Leapfrog is. Tell them about the safety grades of their hospitals and why they should care. And the toolkit provides tools for the employers to use to help them do that, so they don't have to recreate the wheel. The tools include videos that can be embedded in the employer's websites for their employees. We have newsletter articles that can be used in employer newsletters. We have internal social media platforms if you want to use social media to help communicate about safety. We've made it easy for you to do that. We have template emails that can be sent from an employer's CEO to talk about the importance of patient safety. We have posters that can just be downloaded and put by a time clock for short snippets on patient safety and Leapfrog and how easy it is to check how hospitals are doing. So it's a great toolkit, I think, and we're always trying to improve it.
Yeah, it sounds like you have a lot of really great resources for employers and HR professionals who might be interested in sharing this information with their employees. Hey, I know we've said it a couple of times now, but one more time for our listeners, Jill, where can they go to learn more about the hospital safety grades and the Leapfrog Group's work?
So we have two websites for the hospital safety grade. It's hospitalsafetygrade.org. And for Leapfrog, it's leapfroggroup.org. So we make it really easy to go online and find this information.
Yes, and if you put the Leapfrog Group into Google, it will pop up all the options for you too.
Absolutely.
We will also link to those on the website. Finally, do you have any parting words, Jill, that you would like to share with our listeners?
Well, some patients think that selecting their doctor is the only choice they get to make when they need health care, but choosing a hospital can be even more important. Hospitals vary greatly on things like infection rates, surgical errors, and patient injuries. So really the first step someone should make when they're going to need hospital care is find out how safe their hospital is by going to hospitalsafetygrades.org. One thing I would like to see, and I think you mentioned it, Kelsey, is in Missouri, getting more hospitals to do the survey. Right now, you have about a third of your hospitals doing the survey. And employers and employees, they deserve to know how safe their hospitals are. And sometimes it is just letting the hospitals know, hey, somebody's going to use this data to make selections for their healthcare. Meeting with hospitals actually helps cement that message. So either you guys or employers can meet with hospitals and send the message, we care about safety and we'd like you to do the survey. If they see their customers care, they may do the survey. So those are my parting suggestions.
Perfect. Well, Jill, thank you so much for sitting down to talk with us today to discuss the recent Leapfrog Safety Grade release and the many ways the Leapfrog Group is improving hospital and patient safety. Thanks for listening to Be Health Connected, empowering healthy workforces one conversation at a time.
Thank you for listening to the Be Health Connected podcast. For additional episodes or to learn more about employer resources available through the Gateway Business Health Coalition, please visit www.gatewaybhc.org.